MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
Good morning, Professor Bax. Thank you very much for being with us today. Can you tell us, what are you finding some of the hot topics coming out of the ACC this year?
Well, first of all, I'd like to congratulate the organizers of the ACC because I think the meeting is very well attended and it seems to be a quite successful meeting. Hot topics that I have noticed, well, in the field of imaging, I've noticed that the same developments as we have seen in ESC are taking place here, that high-end technology is really being implemented in the clinical situation for difficult clinical problems like valve replacement, valve repair, revascularizations, difficult revascularizations. High-end imaging technology is now being clinically used, and so far it was always sort of tools of the technical people that used that, but now the clinicians ask for these images and they guide their strategies based on the images. So high-end imaging, I include cardiac CT, MR, and things like three-dimensional echo, strain imaging.
Can you give us an example of how these technologies are being used?
Yeah, a good example is the percutaneous valve therapy. There is now a lot of emphasis on the percutaneous valve therapy, both for the mitral valve, even more for the aortic valve. So you know about these therapies that are nowadays possible on percutaneous aortic valve, and there is a lot of imaging needed in these procedures. First of all, you want to carefully select the patients because it's still a difficult procedure with complications possibility, and so you need a lot of high-end imaging before the procedure to select the right patients, and that includes CT imaging, three-dimensional echo. During the procedure, to position your valve and to deploy the valve, there is fluoroscopy needed, but also certainly transesophageal three-dimensional echo is a must in that approach. And then after the procedure, during the follow-up, CT is being used to follow on the deployment of the stents. So in a difficult procedure such as percutaneous aortic valve implantation, imaging is really being implemented.
Now, are you seeing much of a difference in the use of these technologies between Europe and the United States?
Well, I think the both sides of the ocean are going at the same pace at the moment. You see that it's both sides really being used and also in the same settings. So I think that is actually not so much difference and really being used equally at both sides of the ocean.
Looking forward to the European Society of Cardiology meeting, what can cardiologists look forward to in terms of imaging experiences?
Well, it's a bit like here, although we have a little bit more of these focus sessions. The focus sessions are the live sessions where there are satellites to the various centers in Europe. And in these sessions you will see that imaging is really being used in difficult cases such as interventional cases, electrophysiology, but also percutaneous valve therapy. That will be broadcasted in the live sessions, and you will see these live procedures of the high-end imaging at ESC. That is something that I think will attract a lot of attention.
Thank you, Professor. We look forward to seeing you in Barcelona.
Thanks very much.